Hello, everybody. The talk I'm doing today is on functional medicine, a different approach to complex chronic medical care, or a different way to approach complex chronic patients. My name is Armen Nikogosian, uh, and I'm going to tell you a little bit about me. Um, I'm started my training in internal medicine, and I worked in a primary care internal medicine clinic for over a decade. Uh, in 2010, my second son was born. He was diagnosed with autism, and I sought out assistance to see if we could get him better. We kind of looked high and low, and we really weren't satisfied with what we got back. So it made me look deeper into other sort of, at least back then, alternative models as far as things that could help. And I was surprised what I found. That sort of opened my eyes to functional medicine and different modalities. That kind of morphed into from treating him to treating other autistic kids to then opening a functional medicine clinic, which now we see kids, adults, autism, autoimmunity, all sorts of things. But that's really what brought me into it, and never kind of turned back since. Uh, so just some disclosures. I own a private clinic, a functional medicine clinic in Las Vegas, Nevada. I have no disclosures. I don't get money from anywhere else. Uh, this is some disclosure information on the CME Planning Committee at AAMS. Okay, so what is functional medicine? So these are some of the definitions from some of the Institute for Functional Medicine, which is sort of an educational organization that's set up. I did some of my training through them. Cleveland Clinic, it's uh, a nonprofit academic hospital in Cleveland, or medical center, I should say, in Cleveland. They have a functional medicine clinic that's been running now for over a decade now. Uh, so according to IFM, it's an evolution in the practice of medicine using a root cause system-based approach to care that better addresses the healthcare needs of the 21st century. What does all that mean? I mean, to me, what it really means is personalized and precision medicine. We're trying to apply our medical diagnosis and therapeutics on a more personalized level, and we're trying to be as precise as possible for the individual patient. Um, it's a shift from, the old model, which was more disease-centered focus, to more patient-centered approach. We certainly don't turn our back on the disease. Of course, the disease is pertinent, but we're not seeing it as a disease with a person attached, rather a person who has a variety of diseases, and how those diseases interact really dictates how we work the patient up and treat them in the end. So what does that mean? I mean, I just kind of described what holistic means. People throw around that term a lot. It's become almost a marketing term now. But that it really is a holistic approach where we're trying to address the whole person, not just the set of symptoms. We usually have longer consultation times. They're usually 1 to 2 hours long. In my clinic, it's new patient consults are about 2 hours long. Follow-ups are between 45 minutes to an hour. So, by having that extended period of time, it does allow us to collect extended histories where we can look at the interactions between genes, environment, lifestyle factors, all these various factors that can influence long-term health and the various inputs that go into complex chronic disease in terms of how we can get the best outcomes. So why do we need functional medicine? Uh, well, here's some reasons that I came up with. I think they're good reasons. We've seen a sharp increase in patients with complex chronic disease since the start of the 21st century. It's pretty marked increase. There's sort of that distinction between true prevention versus early detection. Uh, we like to think we really are preventing a lot of these diseases. When I was a primary care doctor, I thought I was preventing diseases. What I really was doing was detecting them early, which is good. It's still a good thing. But if you can prevent it, that's better than detecting it early. The conventional approach, as mentioned earlier, is kind of really a lot of it is symptom control. There's also the concept of the broken person, which I'll get into a little later. We discard that concept. And also differences in training. What are some of the additional aspects of training that we get in functional medicine beyond our standard medical training? So true prevention versus early detection. The focus on prevention, really you're preventing these imbalances and dysfunctions before the clinical disease presents. So we're looking for clues that maybe it's in the blood work, maybe it's in the history, whatever, maybe it's in the family history, but we're really trying to see what is this patient set up to get, or what are they in the future going to have, in the near future or far off future. And we try to set up the different parameters to prevent this from happening. We do this by, we try to empower the patient because we do have that more time with them where we can do more education and engage them to build those habits to reduce a lot of those risk factors, particularly diet, stress, good sleep habits, toxin avoidance, those sorts of things. And then through that education, we're going to encourage that lifestyle modification and risk reduction. And we base this on individual assessments rather than population averages. Population averages are helpful. They give us good guidelines to go by, but that individual assessment is really what's going to allow us to personalize these lifestyle modifications to make it work. You can tell someone to exercise 6 times a week. If they absolutely hate going on a treadmill and you're telling them to do that, that's not going to have any staying power. So we try to work with them to see what's going to work with them. What are they going to be most likely to do? So we favor these foundational health interventions over reliance on pharmaceuticals whenever possible. And a distinction I want to draw here is the pharmaceutical piece. There's functional medicine doctors that are naturopaths or chiropractors or nutritionists who don't have prescribing rights. They tend to be more avoidant of pharmaceuticals, mainly because they can't utilize them. I've used pharmaceuticals on my patients my whole career, and I don't want an over reliance on them, but I want to stress the importance of them when they're necessary. So I don't shy away from them when they're appropriate. I think it's important to kind of meld the two kind of schools of medicine together, or schools of thought. And that table there just kind of summarizes some of the differences between functional medicine and conventional medicine. It kind of simplifies it a lot, but it's just think of it as a starting point. So the concept of the broken person. So, there's this sort of concept where, we reduce this patient to a set of disease labels or symptoms or failing organs or whatever it may be. And there's, we understand that some of these things, there's drivers behind them, but then in other instances, we just sort of, just accept that this is what the person has and this is what they're set up for. Their parents had it, so they're going to have it. And that's just the way it is. And we see it particularly with some mental health issues, depression, anxiety, OCD. I don't buy that. I understand there's certainly genetic syndromes, and there are certain things that people may have problems with inherently that's not working in their bodies. But for the most part, I don't think any of my patients are broken, or at least they're not inherently broken. I think you can get broken. But whether it's a physical symptom or a mental symptom, they're all just symptoms. They're symptoms that are coming from the person, and they're things that are driving these symptoms, whether they be inflammation, immune dysfunction, energy inefficiency, whatever it may be. So, so rather than seeing this patient that way, we see them instead as, a series of these interconnected systems that are then shaped by different external factors, whether they be psychosocial, environmental, And it's that connection together where we can get some change with this. In terms of training, some of the differences in training, uh, I went to medical school late 90s. I graduated 2000. So some of this might be a bit dated. I've been out for 25 years now. Uh, but the training I received in nutrition and diet, I I didn't find it to be particularly helpful for me in terms of what I'm doing now. So functional medicine expanded that pretty significantly as far as different diet plans and when they would be appropriate or not. Nutrigenomics, I mean, genomics wasn't even really a field back then. I don't think they'd cracked the human genome at that point. This is a field that's really just jumped in leaps and bounds over the last 25 years and continues to get better and better. Environmental toxicity, that's really a topic that's kind of talked about. There's a focus on acute environmental toxicity, like with heavy metals or whatnot. But what we deal with more is more chronic toxicity, a lower grade heavy metal poisoning or lower grade, mold exposure, pesticide exposure, things that are going to be some of those contributing factors to the complex chronic disease. It may not be a problem in and of itself at the level that it is, but it may certainly be either an antecedent or trigger or even a mediator for the complex chronic disease that we are addressing. Gut microbiome, this one's big. It's a big piece of what I do. Um, you know, the what we what we knew when I was in med school compared to what we know now, uh, significantly different. And this is really a field that is uh, similar to nutrigenomics. There's constantly new things coming out. Even in the time I've been practicing functional medicine, which has been about 10 years, I've seen a lot of changes here. And so, this is definitely a key aspect of functional medicine. And overall balancing of the functional metabolic systems, which I will get into more detail in a little bit. Uh, so how is it different? I mean, some of the things I mentioned obviously is how it's different, but kind of, I guess, more taking a big picture step back. I think the big one is patient-centered care. Of course, we all practice patient-centered care, or we should be. That's nothing unique to functional medicine, but I think the idea that every patient or every case is unique, it's we don't have a whole lot of algorithms. There's some general ones, but I have templates for some of my reports. It's kind of sad. I don't really use them much because I kind of have to write different stuff for everybody. But that's how it is. Everybody's different. They've got different problems and different solutions. Um, we try to look upstream. If you think about it, there's sort of the patient and you have the symptom. The symptom is what's presenting, right? That's downstream. That's what you're seeing. Uh, Upstream is where you're, trying to sort of reverse engineer it back to, what is the system that's driving this? There's this, web of interactions that kind of come together or don't come together, break down, which lead to that illness or those symptoms. On top of that, you've got that unique genetic makeup that's kind of the blueprint that it's set upon. And then you've got internal factors, mind, body, and spirit, and external factors like physical and social environment. All that as a whole then affects total function. I put this little graphic here, the Venn diagram for evidence-based medicine. The reason I put it in there, to a lot of my colleagues I've spoken to, evidence-based medicine to them, means going on, PubMed or Google Scholar and, looking for relevant journal articles. That's a big part of it, for sure. But a lot of people tend to forget the other two circles in that Venn diagram, which is the clinical judgment or experience, as well as patient values and preferences. So, really to get that evidence-based medicine, you have to put the three together. Um, with some of the supplements we use, we don't have the big 10,000 person meta-analysis that you may get with, some of the, big dollar medications that are out there. So we don't always get to draw on that. We may have some small studies, maybe case reports, and a lot of it also is clinical experience and patient feedback. Functional medicine will combine, it doesn't turn its back on Western medicine. It combines the best of traditional Western medical practice along with naturopathic medicine, which makes up a pretty strong core, especially the whole idea of the gut being the basis of health. And then incorporates other modalities of integrative medicine as well, whether it be Eastern medicine, homeopathy, or whatnot. In other words, we use what works. If we're comfortable doing it, it's safe for the patient, and we know that there's some probability of good outcome, we're going to use it. So functional medicine in practice, naturopathic principles, like I said earlier, kind of make the core of a lot of the sort of philosophical basis of functional medicine. And we couple that with the diagnostic rigor that we see in allopathic and osteopathic medicine. And it's a good combination. In addition to that, when it's indicated, we will also use Eastern medicine, whether it's Oriental medicine or Ayurvedic, homeopathy, bioenergetics. Like I said, the only limitation is, safety on the patient, what we feel that we are adept at using. And, we have, some reason that it's going to give us a good outcome based on the problem that we're dealing with. When we take the history, some key elements of it are antecedent, trigger, and mediator. The patient assessment, we're looking at physical, mental, emotional, and spiritual. And again, I'll get into those a little bit later. Our goal, though, is to balance the functional systems. The basis of good health in functional medicine really is good gut health. Optimal bodily function is dependent on optimal immune function. 80% of our immune system resides in the gut. And the immune system has, most of us, we all know about its defense function as far as with infection and whatnot, and some of its regulatory function. But it's that regulation piece is what makes it so important. Is the immune system has a large role to play in how it regulates our different bodily systems so that they work. So it kind of compares, the regulation is a combination of defense, repair, communication, and transport. The graphic that I put there, you can see there's enhanced health, average health, ill health. Western medicine's very good, I think, at pulling people from ill health to average health, pulling them away from that pit of bad health where they could, swirl and get critically ill and possibly die. But to go beyond that, I felt my tools were limited when I was doing primary care. A lot of patients, particularly patients interested in anti-aging and true preventative medicine, they're coming in before they're sick. They're spending their time and their resources. They want more than average health. They've already got average health. They want enhanced health. They want to optimize that health. And with functional medicine, we have the tools where we can offer them that. So the functional systems that I was talking about, I've listed them here. They're kind of a little different. They're kind of more the systems that are under the hood, so to speak. So we have assimilation, and assimilation is essentially how we assimilate those different nutrients and substances that we need to stay alive and be healthy, such as through digestion, respiration. The gut microbiome actually plays a big role in that as well. It's defense and repair involved in self-explanatory. Immune system, inflammation is tied in with the immune system in terms of how it's regulated, turning it on and off. Structural integrity. Structural integrity is, a lot of people are thinking, their skin's in one piece and they're keeping their tendons together. That is part of it, actually. You could go at the really macro level, like, for instance, like osteopathic manipulation. Absolutely, has to do with structural integrity. You're balancing various things at the gross level. But it also goes even to the subcellular level where we're talking about the structural integrity of, say, a neuron. Well, what composes the wall of a neuron? We've got phosphatidylcholine, you've got EPA, you've got some DHA. There's a variety of these factors that go in there. If we have a person who's coming in with neurological complaints and we don't have an answer what's going on, we're going to look at that. We're going to look at, does he have the raw materials so that his neuronal cell wall is it depolarizing? All right, is it or is it some subtle change that maybe is creating this problem? Communication. So the endocrine system, that's the obvious one. But it's also neurotransmitters and immune messengers, and which again brings us back, another function of the immune system beyond defense. Energy, this is a big one in our clinic, in my clinic, particularly mitochondrial health. Mitochondrial dysfunction, something I read a lot about in my first couple of years of med school and basic science. And then I get to the clinical piece and kind of fell off the radar. I just didn't hear much about it other than, some severe cases, some genetic syndromes, or maybe muscular dystrophy or something like that, where you have mitochondrial disease. Mitochondrial dysfunction is different. It's not the same degree as mitochondrial disease, but it's a spectrum of dysfunction that we see as we age. But we also see it in chronic inflammatory conditions. Children with chronic disease such as autism, a large proportion of them have mitochondrial dysfunction. And until you can get that energy efficiency up to par, it's very hard to get them back on the right neurodevelopmental track or even an improved track. Biotransformation and elimination. This is just a big, long, fancy name for detoxification, or how we get the bad stuff out. It's, again, another important focus. And then lastly, transport, which would be your cardiovascular and lymphatic systems. So those are the different systems we look at, and we try to identify, where do I suspect there's problems based on history, physical examination, laboratory values, and then based on that, we then proceed to try to balance these as best we can. So history taking and patient assessment. So these are components of the evaluation that we apply to every patient and problem. During the history, depending on their problem is going to have these elements. There's going to be an antecedent, which are the predisposing factors. There's a trigger, which activates the problem, and the mediators, which are things that contribute to the problem. So we try to map that out, again, to get a better feel for what we're dealing with here. On the patient side of it, when we're evaluating the patient, and I kind of inset these purposely, because I kind of think of it like one of these kind of matryoshka, Russian matryoshka dolls, right? Where you kind of inset one into the other and the other. It kind of, you start out with the physical on the outside, then you kind of go inward to mental, and then emotional, and then spiritual. And just a quick word about spiritual, I'm not a rabbi or a priest or an imam or anything like that. I'm not there to convert anybody to do anything. It's simply a matter of, is there a spiritual aspect to their life, whatever that may be. They may be, into old Greek gods. I mean, whatever. It doesn't really matter as long as they have that aspect in their life, and it's something that they have a belief in. It tends to help the process in terms of what we're doing. This is the functional medicine matrix. This is something, this kind of puts together all the last few slides into one page here. I have a link there where you can pull it off the internet. And you can see on the left side, we have the retelling the patient's story only in the language of antecedents, triggers, and mediators. Modifiable personal lifestyle factors on the bottom. These are really the important factors that have impact on our lives and our health, regardless of what the problems may be, including sleep, exercise, and movement. And under exercise and movement, I actually would include bowel movement in there. That's actually an important aspect. I told you the gut was important. Nutrition, diet goes without saying. Stress, it's not so much what's stressful in your life, it's really more how you react to it or how you respond to it. And lastly, relationships. We're social animals, so we need these relationships. They're important to us, and they have to be a source of pleasure and relaxation. not continued stress or avoidance. And then in the middle, we don't put physical in there. It's mental, emotional, spiritual. Physical's a given. Obviously, we're going to talk about physical symptoms. And then around it, we have the different functional systems. And when I work up a patient and when I'm done, I kind of look to see where most of the ink is, and that gives me the clue where I'm going to start. Where did we end up? What area are we talking about the most? So I wanted to do a case study to illustrate functional medicine. So, and under the topic of complex chronic disease, I think autism spectrum disorder is really an archetype for it. It's, these kids have so many aspects of this that need to be corrected. They have as from the symptom side and the modifiable lifestyle factors, there's so much to do. So they're a good example for it. Autism from the conventional approach, and this is what I experienced with my son back in 2010, was he had a psychiatric diagnosis, and it was based on subjective behavioral criteria from the DSM-5. And treatment was essentially symptomatic management. Now, I'm not talking about therapy. I'm not against therapy at all. I think therapy is fantastic for our kids, but we want to get our kids to a position where they can engage in the therapy so it can do what it's supposed to do. If you have a kid that's, completely on another planet and not there and not responding, therapy is going to be really tough to get anything out of the child. Intellectual disability is commonly diagnosed despite a lack of reliable communication in at least a third of our kids, if not more. The functional medicine approach is different. We look at it as a medical diagnosis, certainly with psychiatric symptoms, no doubt, but we're basing the diagnosis on objective lab abnormalities. Now, I'll accept the autism diagnosis. Someone came in and they went and evaluated the conventional way. I'm not saying it's inaccurate. Yes, they have autism, but in terms of treatment, that the sheet that tells me that they're 2.5 and their mentality is that of a 12-month-old, it doesn't help me. And frankly, I think it's wrong. What does help me are objective lab abnormalities, which tell me what is out of balance so that I can come up with a treatment approach to address these underlying physiological and environmental causes that could be driving the behavior and the neurodevelopmental delay. A lot of the medical disorder piece of it is characterized in autistic kids by immune dysfunction, chronic inflammation, impaired detox capacity, and neurological dysfunction. And the neurological dysfunction specifically actually is global apraxia. That pairing, or those four things there, I see in the vast majority of the kids that I see to some degree. And then there is a degree of other metabolic and neuroimmune disorders that we see sort of peripherally in addition to that. I think another key aspect is a presumption of competence. That's not really a biomedical thing, but it makes a difference in terms of how the child develops. Children don't really know whether they're neurotypical or on the spectrum or whatnot. Their image of themselves is created essentially how their parents interact with them. So if the parents treat the child like they're incompetent because someone told them that they're intellectually disabled and they have the mentality of a 2.5-year-old when they're 6, well, after so many years of that, they're going to actually internalize that and believe it. And I have kids, teenagers, young adults in my practice like that, and it's very hard to get them to do anything because they've decided they are incompetent. And it's very hard to break through to that. So, and frankly, our kids have enough barriers as it is. They don't need more obstacles, especially something that we can prevent. So presuming competence, let's say you're wrong and the kid is intellectually disabled, you didn't harm the child. You didn't harm the child at all. But if you turn the table the other way, the child is intellectually competent and you're treating them like they're incompetent, you can do some serious harm to the child. So I always say err on the side of caution. Just presume competence. As it turns out, intellectual disability is actually rare in autistic children. And I'm particularly speaking about the level 3 non-speakers. I'm not talking about the, Facebook warriors that say they have autism, and they probably do. I'm not doubting that they do, but it's a different type of autism, different level of issues they have to deal with. These level 3 non-speakers, we've started using spelling boards and keyboards. It's been about 7, 8 years now. I haven't seen an exception yet. Once reliable communication is established, none of them have intellectual disability. I'm not ready to say it's 100%. I don't know if anything's 100%, but I am comfortable saying that it's rare. And I hope this is a paradigm shift that continues to change, and the focus, rather than on their so-called cognitive defects, instead they focus on the global apraxia, which is the real neurological dysfunction. So, all right, so let's talk about the case. So this is a 3.5-year-old boy with regressive autism. Parents bring him in to see me. He's a non-speaker. He's got excessive stereotypies or stimming, another way of saying it. He's stimming about 80% of the day. He's got a very restrictive diet. It's pretty much carb-based. The kid's eating well over 75% of his calories are coming from carbs. I mean, the only protein he gets is the mom can sneak a little bit of egg white sometimes into some of the pasta, but other than that, it's almost exclusively carb-based and highly processed. He has chronic constipation. He has a bowel movement about every 4 to 5 days. It's painful. Regularly clogs the toilet, very foul smelling. He sleeps a maximum of 2 hours at a time. He does take multiple short naps throughout the day, so he gets his sleep, but it's broken up. He can't seem to relax. As soon as he falls into that sleep, his body wakes him up because he has this sort of agitated body or restless body. Mom was on a Facebook group of moms, and they were talking about theanine. Theanine is an amino acid that's derived from tea. It's very nice to use for relaxation. You can use it for sleep. It's not habit forming. It's a great supplement. So she's like, oh, what's the harm? I can give it to him. Let's see if it calms him down. Maybe he'll sleep better. She gave it to him. His aggression went off the charts all night. She gave it to him at bedtime. He didn't calm down till 11, 12 the next morning, which is definitely a paradoxical reaction. That's going to be important a little later. So anyway, I see him on physical exam. He's got dark circles under his eyes. He has that look that he's wired and tired. He looks exhausted, but he can't stop moving. He's got retained primitive reflexes. He had positive Babinski. He's a toe walker. He's got piano playing fingers. Piano playing fingers, it's usually you just have them kind of stretch their hands out, right? Like they're kind of Superman, and you ask them to hold it for a minute. With a 3.5-year-old, nobody's going to do that. So you just do it. If they can just do that for even a few seconds, even a couple of seconds, you couldn't do it. Those fingers start moving. And that's a sign of possibly encephalitis or brain inflammation. He had a bloated abdomen. This kid was at 15th percentile on the growth chart. He was not a heavy kid, skinny little kid, had a big bloated belly, very little fat on him. It was all gas, essentially. During the whole consult, he stimmed. The only time he didn't stim was when he was distracted watching, a YouTube video, Miss Rachel or something like that on the phone. And even that, he could only really be engaged for maybe a minute, which, even for autistic kids is a short time. Usually the almighty screen can usually engage the, even a severe autistic kid for more than a minute. But this kid wasn't having it. A minute was all he's going to give. So we do some labs. I use Quest and LabCorp quite a bit. They have actually a really nice menu of labs. There's actually a lot of stuff you can get done through them. Usually we can get it through insurance. I still have to use functional medicine labs, particularly for like stool testing, mold toxins, a variety of things. So we usually do both in the clinic. On the Quest labs, his cholesterol was low. His total was under 150. 150 is actually the minimum. We like to actually see it over 200. Remember, we're not worried about, atherosclerosis or, stroke risk or anything in these kids. What we are worried about, though, is neuroregeneration. We want them to have the materials so that they can have that neuronal plasticity so that they can make new pathways to overcome their apraxia, and you need cholesterol for that. TNF alpha and IL-2 receptor were elevated. Those are both inflammatory markers. IL-2 receptor specifically is more of an immune-mediated, or some people say autoimmune inflammation. That's probably the most common inflammatory marker I see in our kids is that IL-2R. He had a low secretory IgA and IgM. Both levels were low, indicative of immune dysfunction. His IgG subclasses were elevated. A lot of times that is indicative of an increased intestinal permeability, also known as leaky gut. And that's something that sort of plays itself centrally to gut dysbiosis as well as immune dysfunction, which most of our kids have. He had an elevated neuron-specific enolase, or NSE. I use NSE as a surrogate marker for brain inflammation. We actually track this number. A lot of times kids come in, it's really high. His number in particular was, I believe, 24 or 25. I've seen him as high as 38, even almost 39, something like that. We like to see it under 14. A neurotypical kid this age, it should be like 6 or 7, if that. And low carnitine. Carnitine, we check to evaluate for mitochondrial dysfunction. On the functional medicine lab side of it, some of the neurotransmitters, urine dopamine was high. That's a common thing we see. It's typically associated with excessive stimming. He had elevations in HPA and arabinose. Those are indicative of clostridial overgrowth and candida or yeast overgrowth in the gut. He had severe mitochondrial dysfunction on organic acid testing. Multiple nutritional deficiencies I've listed there. That's pretty much par for the course for a lot of our kids, the severe ones at least. And we just got to balance them. Interestingly, as essential fatty acids, there's a lot of focus on fish oil. A lot of autistic kids should be on fish oil, which I agree with. His fish oil numbers, EPA and DHA, were actually okay. I still wanted to get him better because I want him better and okay, but his alpha linoleic acid, which is your plant-based omega-3, that's the stuff that comes from like flax seeds and chia seeds, it was actually undetectable. So that was really his particular issue with that. So we made sure to replace that. When we looked at the stool test, he had severe gut dysbiosis with elevated zonulin. Zonulin's a protein. We use it as a surrogate measure for leaky gut. That in combination with elevated IgG subclasses, you've got a kid with leaky gut, basically. Mold toxins, ochratoxin and mycophenolic acid, they were 12 times and 42 times the upper limit of normal, respectively. So that was an issue. We did a provocation test and some hair elements, but he was negative for heavy metal toxicity. You hear a lot about heavy metal toxicity in autism. That we certainly check everybody for it. We do see it from time to time, but in this particular case, that was not the problem. And we also did FRAT testing for cerebral folate deficiency. This has been in the news lately, finally, after 20 years. But that was negative. That's actually an autoimmune type condition that's very rare in neurotypical kids, but actually fairly common on the autism spectrum. But he did not have that. So we treated him. Comes back about 2 months later. Dietary change. Mom was really great. She just kind of withdrew his preferred foods and waited till he ate the foods she wanted him to eat. And he came around within 24 hours. She had him on a whole food diet. She was focusing on food that basically comes from farms rather than factories. She implemented 100% gluten-free, casein-free diet. And the macronutrient content was really along the lines of an anti-inflammatory diet, where essentially the carbs make up less than 25% of daily calories. So she did a fantastic job on that. As far as lifestyle changes, they started doing intermittent fasting, which sounds kind of severe for a 3 or almost 4-year-old kid, 12 hours per day. But you got to understand, once you can get the kids sleeping, it's not a big deal. Most of that fast is happening while they sleep, so it's not as bad as it looks. She presumed competence. It took a little bit of time, but she understood the importance of that. She started doing that, and she allowed the stimming, which is what I told her to do. Stop saying quiet hands. Stop trying to have them. This is something that you can't reason your way out of with this kid. This is something that starts as an involuntary function. The kid does persist after that. It's voluntary after that, but it starts involuntary. So when you stop it, they'll stop. It's distractible, and then a minute later they'll just start again. So if you really want stimming to come down, get the kid better at the core. You'll see the stimming will come down. And we replaced all the nutrient deficiency I had listed. A lot of the supplements I use, I typically go several hundred to several thousand% beyond RDA recommendations. Quick word about RDA recommendations. This was established in the 1950s. RDA recommendations are a minimum that is recommended by the government to not get a disease of deficiency from a certain nutrient. So there's a little cognitive dissonance here. They're defining a minimum as 100%. Most of us don't think of that way. Most of us, we're in school. You got 100% on a test. That means you got everything right. So it's hard to go beyond 100%. So they did a little bit of semantic play here with the words here. They made a minimum defined as 100%. So people freak out when you go past 100%. That all it means is you're going beyond the minimum. That's it. That's all it means. We did a gut restoration treatment. This included the use of conventional pharmaceutical antibiotics for Clostridia. I like to use vancomycin, oral vancomycin. I think it does a great job. There are herbal options as well. I find the pharmaceutical options to be more effective. We did aggressive supplemental anti-inflammatory treatment, and then we also peppered intermittent use of conventional NSAID medications on top of that. I don't like to give them daily. Side effects tend to come around. But if you use them 2-3 times a week, side effects are actually fairly uncommon. So that's one way you can kind of get the best of both worlds. We implemented a mitochondrial cocktail per Johns Hopkins. They came up with it about, I believe, 25 years ago. This is a great way to support that mitochondrial dysfunction and shore up that energy efficiency. I started them on bumetanide, 0.5 milligrams twice a day. Well, we built that up. I didn't start them at that, but we built up to that. Kept an eye on his potassium levels. The reason I did that, it's actually a small subset of autistic kids that respond to that. Don't ask me who came up with, giving a diuretic that we give, old cardiac patients to an autistic kid, but someone tried it. They wrote a paper on it. In the right autistic kid, it actually works quite well. And the key with this is that you have a paradoxical GABA response. You have a GABA glutamate response. His response to that theanine earlier, where he went kind of, ballistic for 12 hours, that was the clue that told me, let's try bumetanide in this kid. And it worked. He did respond well to it. So we actually kept him on it. And the parents agreed to evaluate their home for mold, because those mold levels were pretty high. So they have to be coming from somewhere. So follow-up number 1, 4 months later, child comes back. He's speaking in single words, about 50% functional at that time. He's got better attention. Stimming has been reduced about 30-40% of the day now. He's sleeping through the night, about 11 hours. The parents tell me that they're really happy because they've been doing ABA and OT during this whole time. They feel they're starting to get results now. The kid is internalizing some of these things they're learning. The ABA therapist is moving on to, they have different plans. The kid's just thriving in the therapy sessions. He's now having daily bowel movements. It's a Bristol 4, which is normal shaped stool. His bloating's pretty much gone. They did an Armen test. Armen test is a really sensitive mold test on a home. They found high levels of mold in their home. Luckily, it was a rental. I wrote a letter for the family. They broke the lease. They just moved out, and it was the landlord's problem. That's actually an ideal situation. Mold remediation is a terrible thing I wouldn't wish on my worst enemy. It's terrible. So rent is good in this case. We started mold detoxification, which is it's a protocol. There's various aspects to it, but I usually pair it with itraconazole, antifungal medication. We treated him for about 3 months on this, and then we adjusted the prior supplements to try to optimize the effect. So we do a second follow-up now. It's about 8 months later at this point. And at this point now, the child's a little over 4 years old, about 4 years, 4 months old. Child speaking in up to 3 to 4 word sentences, and it's functional about 75% of the time. He understands most of what is said to him. Parents talk to him age appropriate. They're talking to him like he's 4. 4 and a half years old. His attention continues to improve. He's exhibiting imaginative play with toys. I saw this in my office. We have this little barn with little animals, and he's having the animals like, they're talking, running around. Uh, a lot of the kids who aren't doing imaginative play, they're throwing them against the wall, they're lining them up, they're chewing on them. So very, very different kind of play. This is the kind of play we would expect from a neurotypical child. Stimming is mostly gone. Yeah, I didn't say it's gone because it's still coming out in emotional extremes. This actually happened during the consult. He uh, he became frustrated. He was putting a puzzle together in the room and it had 6 pieces. And that I have to admit, the toys in my clinic are kind of ratty. They've seen a lot of mileage. So one of the pieces was missing, and he just was really upset. The 6th piece he couldn't find, and I'm sure anyone who's done a jigsaw puzzle would understand that if there's a piece missing. And he starts stimming, but he quickly recovered his regulation. He starts regulating himself within 30 seconds. He's back. He's good. He got over it. He continued to do ABA. The family actually reached out. They found a new occupational therapist, one that was more focused on treating the underlying global apraxia rather than just kind of coaching activities of daily living. Activities of daily living, very important, but the OT can be a very powerful therapist for autistic children. If they have a good understanding of global apraxia, they can really, really get a lot of work done with these kids, particularly at a young age. So, this was a good move on their part. And on the growth chart, he was at 50th percentile. I mean, absolute growth spurt. The kid just, you could tell where he should have been, right? If his diet hadn't been so restrictive earlier. During the consult, he engaged with me directly, had good eye contact, didn't need the phone, the whole 60-minute follow-up. His primitive reflexes were gone, toe walking was gone, no piano playing fingers, no bloating, and I mentioned the stimming with the puzzle. So what's this kid's prognosis? I mean, the kid was still autistic 10 months after I initially saw him, but he went from a distressed, sick kid who's stimming his life away to a happy, inquisitive child who still had some residual motor planning disability. I don't want to be clear. I mean, he wasn't openly communicating verbally. I mean, it was still kind of wants and needs based, but the kid was still young, and the trajectory he was going on, it was, kind of very I'm confident we're going to continue to see more improvement. We're continuing to work to control and reverse his immune dysfunction and chronic inflammation. We're, going to kind of start changing the treatment over to more of neuroregenerative support, which is kind of a different phase of treatment. But I think in 1 to 2 years, I think this kid has a good shot at progressing to completely open communication. If he can't do it via speech, then, by the time he's 6, we start him on a letterboard or keyboard. Regardless, he gets the open communication, the open, independent communication. That's what makes autistic kids unable to become independent adults. If you can't communicate openly with the people around you, you can't be independent. So that's really a big push we have. And of course, speech is preferred. But if that doesn't work, then, there are other methods now that are available. So in the long run, this autism, rather than being a lifelong disability, this can morph into more of a non-disabling, just neurodiverse aspect of his personality, which is, that's not something that necessarily needs to be treated unless the person wants to treat it. So, I mean, obviously I've shared with you one of my more successful case reports, but I want to be clear. I'm not going to do a mediocre or boring one. I want to do a good one. But I'm not picking a 1 in a million case. This is not an anomaly or some unique case in my clinic. Most of the kids I treat get better. There's varying degrees, but there's a good group of kids that are kind of in the same boat with this kid as far as how he's doing. So it's like I said, it's not a rare thing. So in conclusion, in terms of functional medicine, complex chronic conditions such as autism, I hope that illustrated to you, this need for a new way to address these problems, specifically autism, but also, just take that over to other problems that you've treated. Can you treat it better? Is there other ways or other things that you can bring into it that maybe can bring better outcomes? Functional medicine at the end of the day allows you to enlarge your toolbox. And it gives you the opportunity to use the best aspects of conventional medicine and couple that with really thoughtful nutritional and lifestyle counseling, nutritional replacement, as well as implementing naturopathic and other complementary medical principles to essentially just give our patients the best chance possible to get where they want to be with their health. There's some websites I listed there below. My website's on the top. I've got a blog. There's some stuff I have there, some videos and whatnot. For adult functional medicine, I think IFM's is pretty good for finding out more about training. Pediatric functional medicine, I like FMAPS. There's a large focus on autism, but they do also branch out into other pediatric conditions as well. So thank you for your attention. If you have any questions, I have my email down there. Please feel free to reach out to me. I'd be happy to talk to you or email you. So thank you very much.